Breastfeeding provides numerous hidden health benefits for moms beyond just nourishing the baby. Here are some key advantages. 1. Hormonal benefits. Oxytocin release. Breastfeeding triggers the release of oxytocin, which helps the uterus contract and return to its pre-pregnancy size more quickly. This reduces postpartum bleeding and promotes uterine healing. Reduced stress. The release of prolactin, a hormone associated with breastfeeding, can promote relaxation and lower stress levels. Postpartum weight loss. Calorie burning. Breastfeeding can burn an additional 300 to 500 calories per day, aiding in postpartum weight loss. It helps new moms return to their pre-pregnancy weight faster, especially when combined with a balanced diet and regular exercise. Number 3. Lower risk of certain cancers. Breast cancer. Studies show that breastfeeding lowers the risk of developing breast cancer later in life, particularly with longer durations of breastfeeding. Ovarian cancer. It may also reduce the risk of ovarian cancer due to hormonal changes that delay the return of ovulation. Chapter 4. Reduced risk of chronic conditions. Type 2 diabetes. Breastfeeding has been linked to a lower risk of developing type 2 diabetes, especially in women with a history of gestational diabetes. Cardiovascular health. Long-term breastfeeding may contribute to better heart health by improving cholesterol levels and reducing the risk of high blood pressure. Sounds. Improved bone health. Bone density. Although breastfeeding can temporarily decrease bone density, it is typically restored and may even improve once breastfeeding stops, reducing the long-term risk of osteoporosis. Number 6. Emotional and psychological benefits. Bonding with baby. The skin-to-skin contact during breastfeeding strengthens the mother-child bond and can help reduce postpartum depression. Emotional satisfaction. Many mothers find breastfeeding emotionally rewarding, experiencing a sense of achievement in providing nourishment for their child. Contraceptive effect. Natural birth control. Exclusive breastfeeding can delay the return of menstruation, offering a natural form of birth control known as lactational amenorrhea. However, it's not a foolproof method and varies among individuals. 8. Improved sleep. Hormonal balance. The hormones released during breastfeeding can help mothers feel more relaxed and improve sleep patterns even if nighttime feedings are required. Number 9. Helps regulate blood sugar. Improved insulin sensitivity. Breastfeeding can enhance insulin sensitivity, which helps regulate blood sugar levels. This can be particularly beneficial for women with a history of gestational diabetes, reducing their long-term risk of developing type 2 diabetes. 10. Reduced risk of metabolic syndrome. Metabolic health. Breastfeeding may lower the risk of metabolic syndrome, a cluster of conditions that increase the likelihood of heart disease, stroke, and diabetes. It helps improve lipid metabolism and insulin sensitivity, contributing to better long-term health. And 11. Reduced risk of postpartum hemorrhage. Uterine contractions. The oxytocin released during breastfeeding helps the uterus contract, reducing the risk of excessive postpartum bleeding. This is especially beneficial in the first few weeks after birth. 12. Improved mental health outcomes. Reduced postpartum depression. Breastfeeding has been associated with a lower incidence of postpartum depression. The hormonal benefits, combined with the mother-baby bonding experience, may provide a protective effect against mood disorders. 13. Better skin health. Hormonal balance. Some women notice an improvement in their skin's condition during breastfeeding as hormone levels gradually stabilize. Thanks for watching. If you enjoyed this video, make sure to give it a thumbs up and don't forget to subscribe for more tips.